We ready, Major? Good evening, class. My name is Captain Michael Schmid, Civil Air Patrol. I'm a member of the NESA medical team, known as Medic 5. Tonight I'm going to be discussing ground team equipment and also bloodborne pathogens and personal protective equipment. Can everyone see the slide deck that is up? Next slide, please. Clothing, again, first layer of protection, not just from the elements, but from the stuff you're going to be walking through. You know, you're walking through the woods, you're walking through brush, you're going to be running across insects, you're going to be running across twigs, everything. Standard uniforms, BDUs or equivalent, can be altered to meet safety needs within reason. Sometimes that might mean the blaze orange ball cap. You may have some additions. Everyone should be wearing a safety vest. We are a non-combatant auxiliary of the U.S. Air Force doing a mission in the public's eyes. That means we want to look professional. Okay, next slide, please. The following items are suggested team equipment. Your particular unit may have some differences based on local needs and local conditions. Radios, signal panels. Bloodborne pathogens kit should be a part of every team equipment. An entrenching tool or E-tool, small collapsible shovel. Maps and cases, usually in the hands of your ground team leader. Forms, manuals, we run on paperwork. Camera, you may be issued a camera like the ones they used to use up in the aircraft for airborne photography, or you may be using a cell phone camera. GPS, usually a must. Electronic direction finder, the Yelper, the cheese block, whichever your unit uses. A team first aid kit. Barrier tape, standard caution tape. Spotlight, heavy but handy at night. Next slide, please. Following a mission, first step, once you get back to base, go through your equipment, refit, repair. Nothing is worse than going back out on a sortie and remembering that you left your MRE back in your 72-hour pack. You need to be prepared to go at a moment's notice. I've been out on it myself where we came in from ground team training mission, started doing a debrief, went out on an actual mission. This happens. And many times it'll happen on a training exercise. Next slide, please. Also, if anyone has any questions, please feel free to put them up in the chat for us. Make sure your gear is secured that you're carrying. You don't want to be dropping anything. You also don't want longer items swinging around, banging into the back of your legs, tripping you. Have a checklist. Have a checklist for your 24-hour pack, for your 72-hour pack, for things you normally carry on yourself. The gear back at the base or back at your house does you no good. Next slide, please. Any questions?
There are no questions.
Okay, thank you.
I do believe we have one question. There is the question about litters. How does that get integrated with team equipment?
There are multiple types of litters. You have Stokes baskets, you have the collapsing canvas and wood, the old military ones. You have field expedient ones that you may make out of a blanket or a tarp and two long pieces of lumber. There are, and this one is my personal preference, and I carry one in my trauma kit. It's a folding structure. I have the one that can handle 1,200 pounds. And you would look at this and think it's a tarp. We can have up to 8 people carrying that. Giving you, I can't give you a specific lesson on each individual type of litter out there. There's far too many. The best thing to do is to become acquainted with the equipment that your unit is using, whether it be Stokes basket, backboards, etc. As a general rule, the more people you can safely get to carry it, the better. Picking up and setting down the litter, again, there's a number of different ways to do that. Go over this with your ground team. Just make sure everybody's on the same page, because I've seen it happen and I've been in the middle of it. Person in charge says lift on 3. You hear 1, 2, 3. Some people start lifting. Everybody else is waiting for someone to say lift. The other thing is, however you're picking this up, watch your body mechanics. I've been a paramedic for far too many years. I've seen far too many back injuries caused by people bending over and picking up the stretcher with their back. Use your legs, keep your back straight. Be safe out there. All right, now for the fun part of the evening, bloodborne pathogen and personal protective equipment training. Next slide, please. We're not going to go through each individual slide. Some of these go a little further in depth than we really need to go on right here. What is a bloodborne pathogen? Well, it's something that's carried in any bodily fluid, not just blood. Urine, sweat, tears. If it can come out of the body, consider it infectious. There are over 20 different bloodborne pathogens. The number goes up every year. Next slide, please. These are the ones that they consider to be the most concern. HIV, the virus that causes AIDS. Hepatitis B and hepatitis C. Next slide, please. These are some of the additional ones. Everything, you know, malaria, brucellosis, viral hemorrhagic fever, for those of you that don't know what that is, Ebola. Next slide. And yes, COVID is considered a bloodborne pathogen. Other potentially infectious materials, plasma, amniotic fluid, spinal fluid, so on and so on. Again, if it comes out of the body, consider it infectious. If it's the basic rule, if it's red, wet, sticky, and isn't yours, don't touch it. Next slide. How do they enter the body? Breaking skin integrity, basically needle sticks, cuts, scrapes, breaks in the skin. Sunburn can open up a path through the skin. You're out there, generally in the woods, tramping around, you're probably going to get small little cuts on your skin. That can lead to an infection. Next, please. Skip. And skip this one. Skip. We're going to skip a bunch of these. Again, keep going. And I do apologize to the audience. I use OpenOffice, which isn't very compatible with Microsoft Teams. Next. Keep going. Chain of infection, agent. What's the infectious item? Reservoir. The person. Portal of exit, blood. Mode of transmission, bodily contact, portal of entry, cut on your hand. Next. And this one's pretty good. Universal and standard precautions. Why do we call them standard precautions, universal precautions? Because we use them all the time. If anyone has taken an EMT course or above, one of the first things they teach you is scene safety, BSI, which is body substance isolation. Hand hygiene, washing your hands using hand sanitizer. PPE, disposing of the waste, cleaning. Next. Next. Standard precautions. You use these on all individuals. It's used for all contact, blood, all bodily fluids. You can't tell the difference between sweat and some other fluids. Mucous membranes, non-intact skin. If it's wet and it comes from the human body, treat it as infectious. Treat every patient you're in contact with as potentially infectious. This may be a little gross, but I'm sure most of you by now have been out walking around on a training mission. You get back to base, you take off your boots and they stink. That's because of bacteria in the sweat. So helping your buddy, helping your brother bandage a blister, that's a potential source of infection. You should be wearing, at the very least, gloves. Next. Hand hygiene. Alcohol hand gel, preferred method in healthcare settings. With COVID-19, you see it everywhere. It's more effective against organisms. It's convenient, takes less time than soap and water. Not necessarily gentler to the skin than soap anymore, especially with some of the hand sanitizers being produced by companies that don't normally do it. You can use it if the hands are not dirty. As a side note, alcohol is more lethal to the COVID-19 virus than bleach. Next. And again, if anybody has any questions, feel free to put them up on the chat. Using it, I'm sure now everybody has seen it. Press the pump down to dispense the appropriate amount or squirt the stuff out of the bottle. Into the palm of one hand, you rub your palms, backs of your hands, fingers, fingertips, nails, in between until dry, about 30 seconds. Make sure your hands are dry before resuming activities. Next. Hand washing, pretty sure we're all familiar with that now. Thank you, COVID. We now are aware of washing our hands. Comfortable water temperature, wet your hands, apply the soap. This says 15 seconds, 20 seconds is generally a little bit better. Rinse with your fingertips pointing down. Dry the hands with a paper towel. Turn off the faucets with a clean one. Next. When to wash the hands before and after patient contact, whenever you remove gloves, bathroom, meal breaks, after causing, sneezing, fairly common sense. Next. PPE. It's used when there's a reasonable anticipation of exposure to blood, bodily fluids, etc. Provides protection for clothing, skin, eyes, mouth, and nose. Everybody in the United States now is wearing masks. Mask does prevent certain things from coming in, and yes, I'm sure somebody out there will be willing to argue that the size of the virus is smaller than what a surgical mask will filter out. The mask isn't so much to protect others from you, well, protect you from others, it's to protect you from everybody else. Next. Skip that one. Masks and face shields. Cover the eyes, nose, mouth when anticipating splash or a spray to the face. There's a number of different ways you can protect your eyes. I wear cheater glasses. I need them for reading up close. I'm currently running a COVID testing department at a major hospital in Niagara Falls, New York. We're wearing these, we're wearing the full face shields and 95 masks. It's cheap insurance. As a ground team member, even though it is not considered a necessary part of your gear, you should be carrying and wearing safety glasses. Protecting your eyes. All it takes is a second. Tree branch whips back. You lose an eye. You can't replace that. Next, please. Disposable gloves. Personally, as an EMT, I feel everybody should carry some with them. I have a belt pouch that carries 2 pairs, and after I use them, I always replace them. Selecting the correct size, if you're lucky enough to have a Harbor Freight around, their boxes actually give you a sizing chart. I recommend the use of nitrile gloves, the blue gloves that you see all over the place. Vinyl is acceptable. Latex gloves should not be worn. Many people have an allergy to latex. You could be trying to help somebody out and put them into a life-threatening allergic reaction. While we're on that, I'm going to show you real quick doffing and donning these. Now, as ground team members, we should all be wearing leather gloves, or my personal favorite, mechanics gloves out in the field. You don't want to wear these under them. They're hot, they're sweaty, they're a little sticky after a while. They're cheap. When you take them off, and I'm used to doing this in front of a live audience, grab the first glove right up near the wrist. You don't want to touch your skin. Pull it off inside out, gather it into your hand. Take a clean finger underneath. Anything that you got on that glove is now wrapped up inside of it. This can be thrown in the regular trash. For senior members, if you want to have your cadets practice this, I'd recommend getting a couple bottles of cheap shampoo or ketchup. Take it from me, I've taught a number of cadets this. They glove up, you have them rub the ketchup in, and have them take it off without leaving anything on their skin. It's a good activity and it's teaching them something important. Next, please. Your chances are you're not going to have a gown in the field. And for most of the injuries that you're going to be treating, you're not going to need one. If you think there's a chance that you might get something, you know, someone screws up with an axe or a knife and they've got a spurting wound, take care of that first. Get pressure on it. If you need to dress it and you're afraid that you're going to get contaminated with bodily fluids, you have a poncho as part of your ground team equipment, or some rain gear that's waterproof. If it gets bloody, it can be hosed off. Take it, when you take it off, turn it inside out so that everything's inside, tie it up in a plastic bag. I used to carry, you can get about 10 of the old plastic shopping bags into a little film can. They're great garbage bags and usually free. Next, please. Most of you may have heard of compression-only CPR, where we're not giving rescue breathing. It is effective. It's not as effective as performing mouth to mouth. But if you don't have like a pocket mask with a one-way valve and you're not comfortable, by all means, just use chest compressions only. Next, please. We've gone over this. Next. Wash your hands. Next. Medical waste. This is really, I haven't found a PowerPoint slide that really covers the environment that we're going to be in. If you're in the middle of the woods and there's a little bit of blood on the ground, kick some dirt over it. You know, chances are it's not going to be a big issue. You don't need to carry red biohazard bags with you, and for God's sakes, if your team does have them, don't dispose of them in the regular trash because they will not get thrown out. It's the bag. If we're at my hospital, if we're throwing out a roll of the unused red garbage bags, that itself is considered hazardous waste. Next. Cleaning and disinfection for blood spills, where PPE is needed, definitely gloves. wet a cloth with disinfectant. You can get disinfectant wipes now pretty much everywhere. I don't recommend the Clorox wipes because bleach and clothing, not a good mix. You really don't want to have bleach stains on your nice set of ABUs. There are non-bleach ones out there that are just as effective. Wipe the area, apply a disinfectant, let it dry on its own. And follow the directions on the barrel. Every unit now, I believe, has to have a certain number of disinfectant items on hand. Up here in Western New York Group, we carry wipes in each of the vehicles and in our aircraft. Next, please. Clean, disinfect areas, visible contamination. If you get a spot of blood on your uniform, you can probably just use an alcohol wipe. Something I was taught years and years ago, the solution to pollution is dilution. Wash it out. Next slide. And next. Obviously, when you get back, if you've got stuff on your ABUs, you probably don't want to wash that with the family's good clothes. Next. Sure, we've all gone over this. Cough or sneeze into a tissue or curve of your elbow. Toss the tissue in the trash, please. Decontaminate your hands. Wearing a mask if infected with a respiratory illness. Certain Asian countries, every flu season, you will see people just wearing a mask without having to be told. Their rates of infection and the rates of death from influenza are much lower than we have in the United States. If there's one silver lining to COVID, I think in the future we're going to see a lower death rate from influenza, just because everybody has gotten used to wearing a mask. Next, please. Skip that. And skip. Okay, this is somewhat important. Where a safety device exists, you must use it. Your PPE is a safety device. If you have gloves, use them when you're in contact with a patient. I probably went through a couple boxes of gloves every week at NESA. For a sharps container, we really shouldn't be running across that at all. Some people may need to bring an injectable medication with them. If they're ground team members, they'll probably have a small sharps container of their own. Next slide. Next. Again, don't eat, don't drink, apply makeup, etc. In areas where you're likely to get infected. Next. Yeah, don't place your hand in the used sharps containers. Fairly simple. Next. Next. Do we have any questions from the audience right now? Okay. I think we can close out the slide deck. Out in the field, you're not going to have everything that we would have in a hospital or even in the back of an ambulance. But as part of your personal kit, you should be carrying a few pairs of gloves. They're small, they scrunch up, you can stuff them in a baggie, and there's 500,000 things you can use these for. In an emergency, I've even seen people use them as a water container. If you get somebody that gets a burn on their hand, well, you've got a nice dressing. They get a burn or a couple of cuts like across the knuckles or in a hard to bandage place. put the goggles on it, put a snug glove on it, you've now created a nice dressing. We should all be carrying a mask, and this is more for the senior members than for the cadets, because the cadets aren't going into crash sites. But people that do go into a crash site should be wearing a mask. You don't know what's been aerosolized. I know this all sounds a little grim at times, but the goal of this is to keep you safe. When you go out on a mission, job number one is that everybody goes home to their family safely and in the same condition they left. Any questions? Comments, thoughts?
There's one question, actually, I'm replying to now, that I just want to remind members to go to this website for all session recordings.
I'm sorry, Major, you were a little garbled.
There's no questions at this time.
Okay. All right, well, I thank you all for attending. I hope everybody learned something. And thank you all for volunteering to help. And this sounds cliche, but it's true. You're taking the training to go out and help somebody on what could be the worst day of their life. And that says a lot of great things about you. Hopefully we'll see you all next year at NESA.
Thank you, Captain Schmidt, for presenting this evening. And thank you everyone that joined us this evening for our covering topics such as the ground team equipment and bloodborne pathogens. Please feel free to check out the NESA website under e-learning for our sessions, our past sessions, and as well as any upcoming ones. We will be planning more sessions in the future, so be on the lookout for those. This evening we do not have a quiz, but keep watching the website to see if there's one that does pop up. And thank you again. Have a great evening.